Tom Brady, Adrian Peterson, Robert Griffin III. Besides all being top NFL players, these three tough guys have something else in common. They've all torn their ACLs. A torn ACL is a serious knee injury that people usually tend to associate with NFL players, but perhaps football in general. But did you know that women are at significantly greater risk of injuring their ACL than men are? In fact, it's an injury my next guest says he sees in women and girls all the time and all too often. Dr. Lance Winter, he's an orthopedic surgeon on the medical staff of Baylor Medical Center at McKinney, and he specializes in sports injuries. Good morning, Lance. How are you?
Good morning, Amy.
That statistic is a little bit alarming, but let's first explain exactly what the ACL is and why injuring it is so devastating.
Okay. We hear that term in the media a lot, ACL. It's basically made up of three words: anterior, cruciate, and ligament. I'm going to open the knee here and show you what that is. So here in the center here, this yellow marked area is the anterior cruciate ligament. So those are the three words. Anterior means the front, cruciate means cross, and ligament is any band of tissue that connects one bone to the other. This is the main stabilizer of the knee. It's our star player. Helps keep the things in alignment from front to back translation, shifting of the knee from front to back.
Yeah, we need that then. That's an important, but let's address this. I think a lot of viewers will be surprised to know that women are at such a high risk for injuring their ACL. What's going on there?
That's correct. There's several reasons. One is anatomy in female is different. The first thing we refer to is the Q angle, and that is the angle of the quadriceps to the tibia. Women tend to be more knock-kneed, so they turn the knee in. That puts more tension on the ligament and makes it vulnerable to rupture. The notch is more narrow. That can pinch the ligament and cause rupture. Also, the ligament is smaller. There's also something else called a quadriceps. Women are quadriceps dominant, meaning that when they land, they tend to straighten out their leg and it's stiffer and they're more prone to injury.
Okay, so let's talk about the steps we can take to prevent this injury.
Well, we do have an ACL prevention protocol, and that begins with analyzing the jumping of an athlete. So an athlete stands on a box, they jump down, and then they jump back up. And so what we're looking for is how much the knee bends, how much the hip bends, whether the leg externally rotates. The correct position would be the foot centered underneath the knee without any rotation, bending at the hips and knee. Once we analyze that, there's a protocol, training protocol, where we teach biomechanics, proper jumping, landing. We work on agility and core strengthening.
Well, 25 years ago, if someone tore their ACL, it was the end of an athlete's career. But now, the diagnosis is a lot better.
That's true. Things have changed over the years. ACL surgery is one of the most researched surgeries in sports medicine. It's come a long way over the years. 20 years ago, we used to cast patients after surgery, keep them in extension. We didn't allow them to bear weight for a couple months. Now everything's changed. The rehab protocol is, we have what's called an accelerated rehab protocol, where we start range of motion right away. We start weight bearing, we get them moving, and we've cut the rehab time in half from a year to 6 months.
Is that for men and women alike?
Both for men and women.
Okay, thank you so much for this information. Really valuable and interesting to kind of see. We hear ACL all the time, but we don't even realize that women are at greater risk. Good information, Lance. Thank you so much for being here. And for more, log on to BaylorHealth.com/ortho or call this number 1-800-4Baylor. GMT's coming right back. Stay right there.